Today I'm going to talk about a body hair transplant that I had done about 4 months ago, and some of the results have not been exactly what I expected. So today I'm going to show you some pictures and kind of discuss what my results have been so far, what I'm thinking about doing in the future, and all of that stuff. And I've actually never seen anyone cover this, scar body hair transplant thing in detail here on YouTube. So hopefully, if there's someone who is looking for information like this will help them out in some kind of way. All these videos are just made for entertainment purposes. I'm not a doctor, but I'm a patient who cares and loves other patients and wants to help in any way that I can. So 4 months ago, I had a body hair transplant, meaning in this case, they took around 700 grafts from the bottom of my neck around this area right here. And now, I don't know if you can see in the video, but it's healed up like brilliantly. Actually, one of the great things about getting hair from your beard transplanted is that the neck is very vascular and heals extremely well and heals extremely fast. Now, only downside I will say is that I have gotten some ingrown hairs. If you've ever had a hair transplant, you'll know that ingrown hairs are quite common and they're pretty annoying because they grow under the skin and you have to sometimes they'll hurt and you have to pop them out. I've probably had, I want to say, 5 ingrown hairs that were kind of a big annoyance. Really one in particular that's even actually still there. I only have one. It doesn't hurt anymore, but it still hasn't completely come out. But that said, it's not that big a deal. 5 ingrown hairs, it's not the end of the world. Dr. Patrick Mwamba and Dr. Truett Bridges are who did my surgery. I really, really like those guys, and I think that they're absolutely world-class surgeons. I was super, super impressed with just the whole surgical process. I have no affiliation with them in any kind of monetary way. My surgery was done for free, but I get tons of hair transplant surgeons that offer to do surgeries for me for free. I just went to them because they were highly recommended by some other people that I trust. And after meeting them, I just thought that they were super cool guys. I saw before and after results of theirs, and they're incredible surgeons. So I thought it'd be cool and would help me have a more well-rounded, knowledge and more well-rounded experience of this whole surgical process to go through an FUE procedure and with another doctor to just get a feel for how different doctors operate. At this point, I've had 4 or 5 surgeons, kind of 6 actually, work on me, but sort of main supervising. The main surgeons, I guess 3/4, and then technically I've had 6 different surgeons work on me. So it's actually very helpful, I feel like, going through that process because you learn what surgeons do well or don't do well, and you get a feeling for their technique and their personalities and all those things. And so for me, having this channel, I feel like that's helpful for my viewers. So that's the reason why, or part of the reason why anyway, that I've chosen different surgeons. So I had those 700 hairs or grafts put in the back of my neck in a scar that I had from my second surgery. Now, unfortunately, in my second surgery that I had back, I don't know, around 7 years ago or so, the surgeon went way too low in the back, and it was just not appropriately done in my non-medical opinion, but I've had lots of doctors say that. And so they went too low and it left me with a large scar here. And it's quite low. It's kind of like in the nape almost sort of area. So first, let's show some before and after pictures so far of what's happened and go over the good news. And then I'll go over the bad news. Now you can see in this before surgery picture that the hair below my scar is very fine and thin. It looks kind of almost a little bit odd because it suddenly just becomes very fine and thin. It's not the way that most people's hair is. So that's below this area right here. Now, the reason that is because when you have a scar, there is potential, if there's a lot of scar tissue, to cut off circulation below that, especially if it's a lower scar like I had. And when you cut off the blood flow, it can actually cause the hairs underneath that scar tissue, if it hasn't been done correctly, to miniaturize and to give you that sort of look. So one of the things that I'm the most happy with is now if you look at the after picture, this is 4 months later, you'll be able to tell that my hair below that scar is much more uniform. It looks much more normal. And so actually, regardless of the actual hairs that I had transplanted and whether they grow or not, having that surgery done and having those FUE, grafts placed there actually helps draw blood flow to that scar, makes the scar look more normal, just even regardless of the hair that's in it or not. And then also helps to increase the blood flow below the scar. So that whole area just looks more normal. So to me, so far, this has been the biggest benefit of this surgery. Now, I knew going into this that there is a chance that when you transplant into a scar, especially the first time that you do it, you can not get any growth. There is potential for that because scar tissue doesn't exactly act like normal tissue all the time. So on one side of my scar, if you're looking at it right now, the left side, you'll see that there's actually been quite a lot of hair that's grown. And you'll see I have some residual SMP that I had done. That was done probably now a year and a half ago, but you'll see there's still a little bit of like coloration still on the scar from both of the pictures. So that's not new, but you can see in the new picture, the after picture, that the scar looks much better on the left side. There's actually hair that is now starting to grow in that scar. Now, when we go to the right side, the hair has not grown very well in that side. So I'm going to probably go back and get that scar transplanted into again. And now this time it should grow. From what I'm told, the second time around, the scar tissue takes very well to the grafts because it has become more like normal tissue after going through the first surgery. So anyway, this is pretty wild stuff. I'm really happy so far with the results. I wasn't honestly like expecting that much. It's not my hairline. It's not some super important thing. This is more of a learning experience. I went into this the most kind of just excited and interested in learning about body hair transplants and scar tissue repair and all of these different types of things. But I am very happy that the hair below that scar looks much more normal now. I think that that's very cool. And I'm excited about body hair transplants and the opportunities that that can bring to people that don't have enough typical donor hair or, just are in a position where they need to also use their body hair for one reason or another. So anyway, that's the update, guys. I'll keep you posted. Maybe I'll probably do a 1-year video follow-up to this whole thing. And like I said, I'll probably go back and get some more hair transplanted into the left side or maybe into both and just fill it all up and make it gorgeous. And why not? I've only got one head of hair and I've got a lot of extra beard hair. So let's do this.